For hip extension, some people don't have a lot of hip extension, right? So just laying them on the table might be close to their end range hip extension. It's another reason why we need to look at ASI as PSIS instead of just flat against the table, because now if she's already in some anterior tilt, we'll be able to pick that up, okay? So for hip extension, go ahead and lift your leg up and back here. Sort of have to get it pretty quick. Good. And relax. Maybe like 5 degrees of hip extension when you account for the pelvis. If you didn't account for the pelvis, lift your leg up.
It's like 20.
That looks like more than 5 degrees, doesn't it? Right? But it's not. It's a fake 5 degrees because you didn't take into account the pelvis. Okay? Typically with extension, they need some adduction and external rotation to get full extension. So they need to be able to get here and here. If they don't have that, hip extension might be limited. So if they're limited in hip extension and you've been cranking on hip extension all day, think maybe about working on some adduction and ER to maximize your extension. All right? Typical range here that we'd like to see is at least 10 to 15 degrees, and the limitation commonly is going to be a muscle stretch and feel there. All right? And pain or limitation with hip extension is pretty strongly associated with low back pain. For hip abduction, we've